So people think Ket is safe because you can get it at clinics, but do you know what it looks like when somebody can't stop taking it? So today, I, Dr. Suave, your friendly neighborhood neuroscientist, am going to explain to you what we currently know about Ket addictions. So previously, people had only been able to get Ket by basically going to the emergency room if they were in a severe depressive episode. Ket would be given as kind of an immediate treatment for depression, and then this kind of moved from the emergency room to things like Ket clinics. And now it has moved even a step further with things like telemedicine. So people can actually order Ket to then use as like an intranasal administration. So basically snort the Ket. They can basically order this from the internet as a prescription. The only thing that you can't do is have an automatic refill for it. So because of this increase in things like Ket clinics and because of the new compounding substance that's out there, a lot of people are using Ket long term. And this is where one of the major problems comes in. So there are side effects that are so common with Ket that they actually have their own name for it. Things like K cramps, which are gastrointestinal problems. You just have severe abdominal cramps that are extremely painful. And a lot of times people will actually then use more Ket to kind of alleviate those symptoms of the GI problems. It also really messes with your bladder. So we see that there's a 3 to 4-fold increase of bladder problems that are seen after long-term Ket use. So like increased frequency of needing to go, urgency, like you just have to go immediately, not being able to hold it through the night, those are increased after Ket use. Long-term Ket can have a lot of impacts on the brain. So we actually see that it's linked to a decrease in activation in the hippocampus, which is an area of your brain that typically deals with things like memory. And specifically, people who use Ket long-term have a lot of long-term spatial memory issues. And then you get the psychological effects. So things like an increase in anxiety, an increase in depression, but also more delusional thinking and increased dissociation. So dissociation here is measured by how likely you are to say that this commonly happens to you. Sometimes I'm listening to a person talk and then I realize that I did not hear any part of or maybe even all of what they were saying. I was driving my car and then I suddenly realized that I don't remember part of or any of the trip. Those are questions about dissociation. And what we realize is that people who chronically use Ket are more likely to experience those dissociations and those things like delusions, which makes sense from a neuroscientist perspective. So we actually use Ket just like we use PCP to model schizophrenia. And those dissociations and delusional thinking styles are symptoms of schizophrenia. That's why we use it as a model. But what we actually see is that people want those dissociative side effects. Like that is literally why the majority of people are reporting that they are taking Ket. Now, some of them also say that they're taking it for things like self-medication. So it is actually helping with things like depression. But the majority of them are saying that dissociation is what they're looking for. Now, the problem is those effects of Ket, you can't take them apart from their side effects. And side effects are basically the number one reason why people say that they try to stop using Ket. They say the side effects are just too bad. So yes, they're enjoying it. And that's actually one of the reasons why they say they don't want to quit is because they enjoy the effects, but the side effects are so bad that they just cannot keep going with it. And we're seeing that only about 50% of people who actually have this kind of chronic Ket use that reaches this addiction status actually say that they're going to get any sort of treatment for those side effects. So a lot of people still say that they're going to keep using and they aren't going to try to fix the urinary problems that they have, or the headaches that they get, or the blood in the urine that people actually self-reported they experience from Ket use. And one of the reasons they're saying why they won't get help for this is because of the stigma associated with drug use. So after the most commonly reported reason of not quitting just because they like it and they don't want to stop doing a thing that they like, the number 2 was the negative stigma against use. So they didn't want to go to a doctor and say that they are addicted to something. And number 3 is they didn't want their friends and family to find out. And that is likely also because of things like the stigma attached to drugs. And none of this also takes into account the fact that the compounded drugs that people are actually buying online, there is nothing saying that they're actually safe. So people are either snorting or even injecting these, and the FDA has not regulated them at all. So whatever is in them, there's not really an independent agency looking into that. So you need to pay attention to not just the safety of the drug in general, but the safety of where you're getting it from. So people commonly view Ket as being safe because otherwise, why would we have people who are prescribing it? Why would we have clinics out there? And yes, it does have some beneficial effects, but it does have some really problematic side effects too. So we need to figure out better ways to get people help if they want it. One of the most commonly cited reasons for not going through a good treatment experience, not quitting, is because people in the rehab program had no idea about Ket. So people who are actually trying to help people quit did not know the drug itself. So we need better education for the people who are actually using it so that you can know what the risks are, you can start to pay attention to potential side effects, but also for the people who are trying to help those who are addicted. Because drug addiction treatment is not a one size fits all.